So here's the technique seen from an oblique view. Adduct, internally rotate, lift the elbow to the level of the shoulder. Finally, externally rotating, slips that head round into the glenoid ring. Here's a close-up view from the front. Again, adduct and internally rotate, lift the elbow to the level of the shoulder, externally rotate, and it slips back in. I'm going to be in that internal rotation and adduction position. So I'll get you to relax back for me. Think about where that humeral head is. It's sitting behind the glenoid ring at this point. So when you get the x-ray for these patients, you can get a light bulb sign if you've got an AP view. You might see a little bit more in an axial view. Sometimes it can be really unclear, especially if you're looking at a patient who's had a seizure and is confused and can't give you any info. And get a CT if you're not sure. Make sure you know exactly what you're looking at. You can get a reverse Hill-Sachs lesion. That's called a McLaughlin lesion as well. So again, look for those. We're in this position here, so we want to get hold of the patient, take control of their arm fallen, and get them to relax. So this is going to be painful for them at the moment, so we want them as comfortable as possible. Talk to them, tell them exactly what you're going to do. We're going to exaggerate this internal rotation and the adduction, and then we're going to move them around a little bit. So tell them exactly what you're going to do. So I'm going to get hold of your arm. I'm going to really, really gently move it up in front of you. If it's really sore, let me know and I'll stop. But I think we'll be able to reduce this for you and get you really comfortable. Okay? So I'm going to get a grip here and a grip here. Just relax back into the bed for me. That's great. I'm going to adduct it further, internally rotate. And then I'm going to very, very gently lift this up to the level of the shoulder. And then externally rotate. And then bring it around to the side. And that's our movement. Okay? So I'll show you that again. I'm going to exaggerate that internal rotation. Try and relax as much as you can. Sit back into the bed for me. That's great. Okay? And I'm going to bring that all the way up to here. That's our movement. Okay? And generally find you do it nice and slowly like that. The patient will allow you to move it. If you feel that they're fighting against you, then explain to them that the muscle spasm is going to stop it from reducing. But if they're able to, or if they're not able to do that, you might have to put them to sleep. That's fine. But by doing this, it's likely to slip back in. Okay?